Right, so next we talk about do's and don'ts of tree building. So we observe that a diagnostic test to obtain additional information is worthwhile only if at least one of the decisions would change by the test result, and if the risk to the patient associated with the test is the less than the expected benefit that could be gained from the subsequent change in the decision. In other words, the aim of obtaining more diagnostic information would be shift our probability of assessment across the treatment threshold. Let's consider our previous example. We knowing that obtaining more information may not be appropriate for the young pregnant woman. However, in other cases, for example, the elderly people, this can be an option. Therefore, we have the tree view as shown on the right hand side over here. Now we have a three option instead of two: AC, CTPA, and no AC, where CTPA is means CT pulmonary angiogram. Now, after performing the CT pulmonary angiogram, we are again faced with the choice of whether or not to give anticoagulation, AC versus no AC. Therefore, the tree also reflecting this consequence and also a decision choice as well. However, very important point here that after perform CT or pulmonary angiogram, we have a pretty good information about the patient if he or she has the PE or not. So after a CT pulmonary angiogram and we have the positive result of the PE, it means PE is present. So anticoagulation is clearly a better choice here. On the other hand, if P is not present, withholding anticoagulation is the better option here. With that said, we know pretty sure that some of the branches of the tree, for example, PE right here, and this option gonna be pretty for sure we're gonna take it. So it means no AC right here gonna be never happen in our decision making. So with that said, some of the branches of the tree can be removed, and that's the concept of the decision tree in strategic form. So the decision tree in strategic form is mean the decision tree in the extensive form with the removal of the branches where it will never happen in our decision making. So we end up with the decision tree in the strategic form right here is much simpler and easier for us to make decision for the cases with a similar structure. To illustrate the difference between intensive and strategic form of a decision tree, let's consider the first case example of young pregnant woman. So here we assume that we can also use clinical prediction rule prior to deciding whether or not to use anticoagulation. So the clinical prediction rule can be based on the demographic, the sign of the symptom, the lab test, such as the edema test, in order to decide or make our decision. So use this information, we can construct our decision tree in extensive form as we saw on the figure A over here. Now, with this extensive form, we know that some of the branches or some of the options we will never select in our decision making. So we remove some of the branches. For example, the prediction PR very high. So this one obviously we're gonna take the AC. And in order to simplify the extensive form to help us easier to make our decision, we have the strategic form as shown on the right hand side over here. So it's very important note for a decision tree in the strategic form is that it's obviously much simpler, and also we're showing that now instead of the decision go after the chance notes right here, we're going to bring up all the possible options right here up to the front of the decision node over here. So the structure of the problem is pretty the same, but now the structure of the tree much simpler, so easier for us to understand and analyzing our decision problem. Another observation here is that the strategy defined by the chosen positivity of the clinical prediction rule. So for example, we can decide above some threshold, we will choose the option AC, and lower than some specific values, we're gonna choose the no AC option. So the strategy form can be particularly useful when analyzing cost effectiveness or performing the sensitivity analysis and determining the threshold between the strategies. We can revisit the topic in our future lecture. Right, so in summary, in which two lecture we focus on constructing a decision tree by using the proactive approach to select the best treatment option. We also discussed the sensitivity analysis for verifying our decision. This is a very important topic that you will use it for your future group project, so please review the content carefully. I hope you enjoy the content, and I see you in the coming lecture.